Hello, my name is Dr. Luis, and today we are going to talk about one case. And as you know, that in ultrasound already very popular in our practical clinical case. And sometimes we use ultrasound as a very useful way to help us to do emergency case. When we mention about the emergency case, you always think about the car accident or the high building falling down case or other emergency case. But here, I'm going to talk about another kind of emergency case, which is very popular, but also could be very important case for us to decide whether we need to do surgery or not. Since this kind of animal will also have a very high risk of sudden die. So we are talking about the problem with the male cat, the urinary tube inflammation, and which will cause the urinary tube block. And in this kind of situation, we need to decide whether we need to do surgery and to rebuild the urinary tube or not. So we will see this case. Talk about, and his name is Bei, and around 3 years old, and it's a male cat, and this cat have this kind of disorder for many years, and each time when the cat cannot pee, the owner will bring the cat to a clinic, and the doctor will try to put a urinary tube and try to draw the urine out, and then give anti-inflammatory treatment. All the treatments are correct, but this cat always have this problem. So this time the cat have the problem for 5 days. The doctor even cannot put the urinary tube inside, cannot take the urine out, and we have to, or the doctor have to take and put the needle and take the urine directly from the urinary bladder. And 5 days later, the doctor referred the case to me. So the doctor wanted me to do the surgery to rebuild the urinary tube. So this is the complete blood cell count, and this is the chemistry. And from the X-ray, we can see that here is the urinary bladder. The urinary bladder is quite big, and this is the kidney. And for this kind of situation, we need to let the owner know that for the animal who have the urinary bladder disorder, and even if they cause the urinary bladder urinary tube blocked, we need to tell owner that the cats will have very high risk of sudden death. And before I do the X-ray, we need also preparation the urinary bladder. If it is too big, we need to take a little bit of urine out. So this is another X-ray, and here is the urinary bladder, and we will see ultrasound, and here is the kidney. We do not take, we cannot put all the image of the kidney in one picture. From here, you can see we cannot see the contract of the medulla and cortical. Here also, the margin of the kidney is not smooth and have the liquid, and this which suggests that the acute kidney failure. And this is the image of the urinary bladder. You can see the urinary bladder is quite big, and this is all of the urinary bladder. We can see very clear the 3 layers. This is layer 1, 2, 3, The three layers are quite clear, and the thickness of the urinary bladder is normal. And also the urinary bladder wall is smooth. So that means at the moment the information of urinary bladder is not so bad. But you can see the urine inside. Normal urine should be black, completely black. But here we can see a lot of white spots inside. That means there are some criticals or sometimes the red blood cells inside. And criticals will cause the non-urinary bladder block. So we check the lack of the urinary bladder, this area. The all of urinary bladder is quite also normal, and in this kind of situation, we need to think about surgery. So we did surgery, and we spaced the cat, and you can see in the non-urinary tube, there are a lot of criticals blocked there and become very big, like a stone here, block here, and also here. So that's why we cannot. That's why it is quite difficult for us to put the urinary tube inside. So this kind of situation, if the cat have a non-urinary information and always cannot pee, we need to think about do surgery to rebuild the non-urinary tube to make it bigger and healthier.
Okay, thank you for watching this case, and I hope it will give you some information. As you know, in this case, the cat have this kind of problem for very long time, and each time the cat was sent to the doctor, and the doctor will just put the urinary tube and help to draw the urine out and give anti-inflammatory medicine, but the problem always come back. But this time the cat was very bad situation for 5 days, cannot pee, and the doctor tried to put the urinary tube in and try to get the urine out, but failed, cannot. So that's why they have to do this, take the needle and take the urine from the urinary bladder directly, and then that's why this case sent it to me emergency, and we did the surgery. And after surgery, after 5 to 7 days, the cat was doing perfect, and the owner was good, and the cat was discharged and they go back home. So this is a very good case to show us that in our clinical practice, ultrasound can be a very useful way to help us to do the diagnosis in clinical case, especially sometimes emergency case, and of course we will show you more cases in the future. So see you, bye.